This is case 11.
Yeah, I think it's back to me. So the first thing my eyes go to are the epidermis and how it's kind of effaced and the lots of reedy ridges there.
Good.
And then right below that pigment in the dermis that looks to be not natural. So I think if I were looking at this, I would zoom in on that. Otherwise, it looks relatively normal.
Except look what we have here. We have a little bonus finding here.
Oh yes, a little island of basaloid cells, probably a basal cell skin cancer. So kind of taking all of this into account of the effaced epidermis, that little fragment of basal cell tumor, this pigment is probably a biopsy site that hemostasis was achieved with Moncel solution.
Very good. Yes. So here it's even better over here where you can really see like some nice parallel fibroblasts, parallel to the epidermis, vertical vessels. So there's scar here. Then there's kind of some scale crust, and then the epidermis has regenerative changes here. So this is an excision specimen, and we are lucky here that we also get, like you said, there's a little island of basal cell carcinoma, which is another clue that this is an excision specimen. But without history, you might struggle here wondering what's going on. So, and I love that you pointed out right away, reedy are gone. So this atrophic epidermis without reedy, that's what the epidermis looks like as it regrows over a wound. And so that's another clue that there was a biopsy performed here. So we don't see this very often at all anymore because most dermatologists that I've worked with do not use Moncel solution. So Moncel solution is ferric subsulfate, and it can be used after a biopsy to achieve hemostasis, as you said, to stop the bleeding. But the problem is that it can produce this pigment deposition of this iron pigment that looks a lot like hemosiderin. Can actually make a pigment that's seen clinically, so what's called a Moncel's tattoo. So pretty much everyone that I work with, except that I've worked with a couple old school dermatologists in the past that still use Moncels, but everyone else I know uses aluminum chloride or Drysol, which has a different appearance microscopically, granular blue-gray histiocytes with little speckles in them and kind of purple calcified burned collagen fibers. So I don't know what the reason is why some people still use Moncels instead of aluminum chloride. I don't know if any of you guys ever heard of a reason for that. Does it achieve hemostasis better, or is it cheaper, or is it just maybe a matter that people got used to doing it, and if you trained in a day where you did something, sometimes you stick with what you know? I've never heard a good argument for why there would be a reason to continue using Moncels rather than aluminum chloride, but
I think it traditionally does provide better hemostasis. It's just the staining that we try to avoid. So we do have it in clinic, and a couple of our nurses will take it out if there's a little bit of a bleeder on one of our biopsies. But yeah, in general, aluminum chloride.
That's good to know. So yeah, I have no financial interest. I don't even know who makes either of those products, but I always wondered because I almost never see this. And in fact, it's so rare that when I would see it on a specimen, I would know, I know who biopsied this previously, even if I didn't see anything else in the case, because I only had like a couple derms that would use it. So in any case, the reason it's important is because A, we don't see it very often. And so if you've never encountered this, you will be bewildered the first time you see it. So how do we know it's not hemosiderin? Well, I'll tell you. When we see a biopsy site change, the granulation tissue that fills in the biopsy site and then turns into scar almost never has hemosiderin in it. And I think the reason for that, I've thought about that over time. No one ever taught me why this is, but I've looked at thousands and thousands of cases where there's biopsy site. And I was like, why don't we see hemosiderin? I think because what happened is a shave was done here. All this, a month or so ago, was air. It was scooped out and removed and was empty space. And then the granulation tissue, as it fills it in, any blood is on the surface and gets pushed up and kind of makes the scale crust or the scab over top and gets pushed up and out of the skin, like we see happening here. All the crust on the top gets pushed up by the new granulation tissue, and then the granulation tissue, which doesn't have hemosiderin, it kind of fills in and produces the scar. So I feel like we often at a biopsy site, in scars from other reasons, you can see hemosiderin, but in biopsy site scars, I don't see much hemosiderin usually. Whereas here we see like, this would be like tons of hemosiderin overload, right? So the granulation tissue here is mixed with this stuff that looks just like hemosiderin, but there's so much of it. That's just not what we would see at a biopsy site change from regular bleeding, okay? The other thing that's important to note, is that Moncel produces a really robust fibrohistiocytic kind of pattern. It makes lots of histiocytes and fibroblasts, so it tends to be much more cellular than regular granulation tissue that we would see like in an aluminum chloride treated biopsy site or a scar from other reasons. And the reason that's important is because I've seen this before on a melanoma excision where one of my trainees had looked at it and thought that it was actually melanoma, because it was really quite spindly, and I can't remember if the patient had a spindle cell melanoma, so they thought spindle cells, there were some mitoses in it, there was brown pigment. Now, melanin and hemosiderin do look different, and again, I think to me, Moncel's pigment itself looks, to me, identical to hemosiderin. Stains with iron stain, it'll stain like bright blue on an iron stain. It has a refractile kind of golden appearance, and like just like hemosiderin does. And melanin is more like a kind of fine powdery brown, not quite so golden orangey look. But in real life, I have been tricked before. Even as a dermpath, I've thought something would be melanin or hemosiderin and been wrong. So I think usually I'm pretty good at telling them apart, but every once in a while they can have overlapping appearance. So that's an important thing, is that you don't want to mistake this for actually like melanoma or a tumor, which here clearly it's not, but I have seen times where that happened. And I could see how it could happen, because you can have mitotic activity in the granulation tissue and in the proliferating fibroblasts. So for some reason you get a more robust fibroblastic and histiocytic response to Moncel, and so it can look a lot more cellular and kind of scary in some cases. So just something to be aware of, because we don't encounter it very often anymore, so I think it's not on people's radar, and I only see it occasionally.